Good day, everyone. My name is Allison Selby. I'm a registered nurse here at New York Presbyterian Brooklyn Methodist Hospital. This is one of several speak out for safe staffing. And why are we speaking out for safe staffing? Because safe staffing saves lives. Safe staffing saves lives. Okay. After the year we had, it will be good if we have staffing so we could save more lives. Because we know what we went through last year, and there wasn't enough staffing. A lot of people died. COVID-19 exposed the deadly consequences of unsafe staffing in New York City. The New York State Attorney General recently reported on nursing home deaths. It's just the latest piece of evidence that safe staffing saves lives, improves health outcomes. Staffing at the hospital is inadequate, but it's not just this hospital, it's hospitals all over New York State. Unsafe staffing is everywhere, but it impacts patients in low economic communities and communities of color more than others. All nursing home residents and hospital patients should be protected at least the minimum safe staffing standards that apply to all facilities equally, regardless of their zip code, because we all know science has proved that safe staffing saves lives. So without further ado, I'm going to announce the first speaker, which is Joanne Bonnet. She is a pediatric nurse here at New York Presbyterian Hospital, and she's also on the executive committee here at New York Presbyterian. Welcome, Joanne.
Good morning, everyone. I'm Joanne Bonnet. I'm a pediatric nurse, as you can see from my Peds t-shirt. I've been here for 20 years. I've been a pediatric nurse here for 20 years. And this second surge, or the end of the first surge, our unit was closed down and our pediatric patients are sent to Columbia, almost 2 hours away for the parents if they get admitted. We are now pediatric nurses caring for adult med-surg COVID patients. It's a mixed unit, med-surg and COVID, but they're adults. And the peds nurses who've never been oriented to adult med-surg patients are caring for those patients. The hospital administration uses the excuse of COVID to shut down our unit, and also, not to mention just pediatrics, but psych also. These units are considered units that don't make the hospital money, I imagine. They use the pandemic as an excuse to throw the nurses into new specialties, which is what they did to us, and use COVID as an excuse for understaffing. Nurses are professionals with specialty practices. They ask us to be certified in our specialties for a reason. So I'm certified in pediatrics. Irving here is certified in psych. The med-surg nurses are certified in med-surg, and so on. When we've asked for orientation or training to care for this new patient population, the CNO tells us to use our brain and figure it out. My brain has a couple of degrees, but it's in nursing science, in human being, in caring and compassion. So the financial part of the hospital business, I don't understand. All I know is that I want to give the best quality care I can give to my patients, and I can't do it if I don't have the proper tools and I don't have the proper training. So maybe this doesn't make sense to administration, that we don't understand how they see things, but they also don't understand how we see things. It's been an emotional time to be a nurse, and not just because of the pandemic. It feels like abuse. It's a harsh word to use when we're supposed to protect people from abuse, but this is what's the entail of this. I'm not even blaming the pandemic. It's not the pandemic anymore. We're in it. So last year we were heroes, and this year we're just being abused. How much can one push someone? We're seen as just a number, a license, somebody that can provide care. If I can provide care to your child, do you really think that I can provide care to a 45-year-old, a 50-year-old, a 60-year-old, much less an 80-year-old? This fall, approximately 100 nurses have left. There's been no hiring close enough to replace the nurses that we've lost. In the new year, we were just told even more nurses have left. Unsafe staffing is a problem throughout the hospital. This is the worst I've seen in 20 years here at Methodist. As hard as nurses work and as much as we care, we cannot meet the safe standards of care. If our administration continues to refuse to give us staff that's qualified and trained in every unit, not just peds and psych, med-surg, ICU, CT ICU, the ER. When you love what you do, when you're trained as a patient advocate, you should have the voice in providing a safe patient care. Nurses should be able to make the hospital a better place. This should be a partnership where we all have the same goal to provide safe, quality care to our community. We need to hold NYP accountable. We all need to call our state legislators, help nurses have a voice in patient care, help guarantee a safe standard of care for every patient with the Safe Staffing for Quality Care Act. Safe staffing saves lives. We need your help to do this, though. Thank you.
Thank you, Diane. The next speaker is going to be Al Crispino. He's an infection control RN here at the hospital, and he's also the vice chairperson of the local bargaining unit. Along with other members of the New York State Executive Committee, he is a member of the RN Staffing Committee who meets with the hospital management regarding RN staffing. Al Crispino.
Good morning, everyone. Just want to let you know that our nurses work tirelessly throughout the pandemic. Our department has been so busy. We have seen how the pandemic has gone up, and everyone needs to know that our hospital is busy. We want to know what's going on with hiring. We have lost 100 nurses throughout the past few months. We only hired a few. We want to know what's going on, what is the plan for our psych units. We want to know what's our daily function throughout the hospital. Yes, we know we couldn't be getting travelers out there trying to get that, but that is temporary. We need to get more stable nurses, increase staffing ratios, and to protect our patients. Safe staffing saves lives. We know that. So we need to get our plan intact. We need to find out from our CNO, find out what's going on, and we need to get our numbers up and get our plan going. We need to help our nurses who are on the front lines right now. Last year, our nurses worked very hard to follow through all the wave of the pandemic. Now, we have ample time to prepare. We've been asking them what have been our plans since before. How are we going to train our nurses to be better to handle the pandemic? And I don't know, maybe there's going to be another wave coming, if anything. So we need to know what the plan is. So we help us support our nurses in the front lines. Thank you.
Thank you, Al. The next speaker will be Brooklyn Borough President Eric Adams.
Thank you so much. And we have been here having and engaging the hospitals on this conversation for so long. We need for them to hear us. New York Presbyterian must understand the urgency of the moment. When you don't protect the front line, the dangers get behind the line. What you saw on our subway system when individuals stabbed 4 people, it is because of the closing of our psychiatric beds throughout this entire city. What you see when 3 children commit suicide in the DOE is because of the erosion of the frontline nursing staff. What you see in the increase in COVID cases is because of the minimum manning that it takes to make sure that people receive the quality care that they deserve. Far too often, we are failing at the basic child game. It's called connect the dots. Connect the dots. We're looking at the erosion of quality care by not having the minimum manning and believe it's only impacting this hospital institution. No, the lack of quality is cascading into our city and it's eroding the quality of life for far too many New Yorkers who are coming here for care. The role of a nurse is to provide care, not to sit in the hospital bed needing care because they're overworked, they're over-traumatized, they're not getting the support, they're being stretched too thin. So on one day, we clap and treat them like heroes, and then the next day, we abuse them and treat them like zeros. You can't have it the same way, the same thing. Either they are heroes and we treat them with heroic actions, and that does not mean clapping at 7 p.m. Giving them a hand means giving them more hands inside the hospital where they need it. And that's why we're here. They have been giving us this clarion call for the entire pandemic. They've been on the front line. They've noticed the erosion in the quality of care. We need to listen and give the support that's needed. That's why I'm here, because I believe if we don't get this right, we're going to treat our city wrong. Thank you very much. Thank you for what you're doing, nurses.
Thank you, Eric Adams. Next, we have Councilman Brad Lander.
Thank you. What do we want? When do we want it? Now. What do we want? When do we want it? Now. What do we want? When do we want it? Now. Thank you, first of all. I just want to begin by grounding myself by saying thank you to the nurses and the healthcare workers who have shown up every single day of this pandemic. So let's start by giving them just a big clapping. We'll talk more about the clapping in a minute. And second, I especially want to thank the New York State Nurses Association, NYSNA, for organizing and showing up for nurses and helping make sure that we see them and fight for them. As our borough president just said, you know, all through the spring we were on our stoops or leaning out our windows every night at 7 p.m. clapping for these heroes. But we have not showed up for them beyond that clapping. We came out here in the beginning in the spring because PPE was not being provided. Our nurses and healthcare workers didn't even have enough PPE, and we had to come out and scream and shout. And then we came out again because the mental health care beds and money was being cut, and we did not show up for our healthcare workers or for the people most in need on the streets of our city in a time of pandemic. And of course, in recent days, we have seen how much we failed to show up for both the staff and the people in our nursing homes when they needed it most. We did the opposite there. We took public actions, the governor took public actions that caused more people to die, and we have not even shown up to say we're sorry. But look, what we know is this very clear thing about what we can do to honor that clapping we did at 7 p.m. back in the spring. Because here's one thing we know for sure. Help me out. Safe staffing. Safe staffing. So if we know that, if we want to, in any small way, honor that clapping we were doing, say we see these heroes, show up for patients, save our healthcare system, it is time right now to move to safe staffing, to put the resources in that are necessary to save the lives and the health of patients, to make our institutions, our hospitals, and our nursing homes work better, and to show up for our nurses, our healthcare workers. Thank you, NYSNA, for organizing us. We are going to keep standing with you and fighting together until we get this done. What do we want?
Safe staffing.
When do we want it?
Now.
What do we want?
Safe staffing.
When do we want it?
Now.
Thank you so much. We're with you.
Thank you, Councilman Lander. Next, we're going to have Christina Hilo. She's a med-surg RN at the hospital here. Christine and her peers has given unsafe assignment more often in the recent months due to management not hiring and retaining enough qualified nurses. Christina.
Thank you, Allison. My name is Christina Hilo. I have been a nurse here for the past 2 years as a registered nurse. But this hospital is not just important to me because it's my job, but my daughter was actually born here also. What I'm going to tell you this is I love my job. I love taking care of people. I love my staff. I love my nurse techs. I love the environmental people. I love working at this hospital, okay? But this, what's going on right here, right now, with the understaffing of nurses is wrong. You know, we are blessed to be in Brooklyn. You know, this hospital, you could call it a mini United Nations. We have people from everywhere and the Caribbean, Puerto Rico, everywhere. You name it, we got it. But here, this is what my patients are saying. Quote, the nurses are amazing. They went above and beyond to take care of me, even though they are badly understaffed. Okay? I love the hospital and the staff, but it pains me to see how overworked the nurses are. All right? So we are understaffed, and we are not able to do this much longer. Why? Because it's short-staffed. Why are we short-staffed? Nurses are leaving. Nurses are getting sick. We are in a pandemic. We're human. Our families are getting sick. We have to take care of them too. And what should staffing look like? So I'm a mom, and when my child is remote, I teach her some math. Let's do some math, everybody. Okay? The golden standard. In California, nurses had fought for safe staffing regulations. In med-surg units, it is 1 nurse for 4 patients. 1 nurse for 4 patients. Okay? How much now, if you have 8 patients, how many nurses should you have? 2. Oh, 2 patients. Good job, everyone. You all get a gold star. But let's see what's going on here. When we are short-staffed, we have 7, 8, 9, 10 patients. Oh, you think we can you think this is safe?
No.
Do you think this is safe?
No.
This is not safe for the people in our community, especially. Come on, this is Brooklyn. We are people of color here. This is not safe for our communities. So let's put that standard. If you want 1 nurse for 8, 7, 9 patients, you're putting us to a limit. We cannot keep doing this. And just so you know, this was happening before the pandemic. Okay? We need more nurses. Okay, no more clapping. Give me your hands. We need them in this hospital. We need the nurses. We will train nurses. longer. So we need safe staffing, okay? That's what we need. There is a bill that is trying to be passed in our legislature to make sure that we have it. It's called Safe Staffing and Quality Care Act, okay? And as a nurse, our job is to advocate for patients, okay? That's not just our job, that is our principle. We took an oath to take care of our patients. We took an oath on our lives, and we will fight to make sure that we have safe staffing. And why am I so emotional? It's because this is people's lives. This is not just about bread and butter. This is our people's lives. And if you want everybody to actually be safe in this hospital, you need safe staffing, not just nurses. Come on, the environmental, we know everybody, we need more people. And I know there was money that was just given by the government to this hospital. I saw that in the news. But come on, now let's make sure that this happens. And we need to push as community, as nurses, as everybody in this hospital to fight for safe staffing. Safe staffing.
Save lives.
Safe staffing.
Save lives.
And we are still fighting the coronavirus. Come on. Amen.
Thank you, Christina. Thank you. Next, we're going to have Francois Genty. He's representing Assemblywoman Prentice.
Good evening, good afternoon, everyone. I'm Francois Genty. I'm Francois Genty, Chief of Staff for New York State Assembly Member Mathilde Francis. Mathilde Francis, Assembly Member, has been standing with NYSA and supports this cause and this fight. Too many times we clap, as the borough president said, but we don't lend a hand. And it's time to lend a hand. At this time, I'm going to read a quote from the Assembly Member. Nurses and healthcare workers across New York State has fought to protect New Yorkers when the pandemic was at its worst. They put their lives on the line, and many of them paid the ultimate price. They continue to put their lives on the line daily to protect us. We need safe staffing to protect both patients and the heroic nurses. Now is the time to get it right and improve our healthcare system for a better day. This is what the Assembly member said. Safe staffing.
Save lives.
Safe staffing.
Save lives.
Thank you.
Thank you. Next, we're going to have Assemblywoman Joanne Simon.
One of the things I try to do is make sure that people can see my face. So it looks a little weird, but I was a teacher of the deaf, and I want to make sure that everybody can see what I'm saying. So I want to thank you all for being here. It's an honor to be here with you again. You know, as Brad said, we were here fighting in the past. We were here fighting on the psych beds, and we're still here, and we're coming back. It has been an honor to be a sponsor of the Safe Staffing for Quality of Care Act since I've been in the Assembly. So this is my 4th term, my 7th year that I am on this bill. And you might say, why has it taken this long? Well, I can't tell you I know all the answers, but I do know that there is increasing momentum behind passing this bill and making sure that we say very loudly from the legislative level that safe staffing saves lives. We know it will result in better outcomes for patients. It is not just about the workers, although the workers are very important, and that is also very important, I know, to the members of the Assembly and our legislature, but it is also about patient outcomes. And COVID has been has messed everything up, but it cannot be the reason we cite to for the things that we weren't doing the right way in the first place. And this bill I've been on, This is my 7th year. COVID's only been around for a year. We know we needed this. We needed it before. We still need it. And I will continue to fight shoulder to shoulder with you to ensure that this bill gets passed and that our staffing levels are adequate and safe for everybody. Thank you.
Next, we're going to have Nancy Hagan. Nancy Hagan is on the board of directors for NYSNA, and she's also a nurse at my Maimonides Hospital.
I'm going to echo everybody. Save. What does safe staffing do? It saves lives, okay? First, I'm going to start by saying, during the COVID-19 last year, nurses, we were not prepared. We didn't have any equipment. We came to work. We went out of our ways. We stayed here 20 hours. We left our family behind. The hospitals, they knew about it, they were not prepared. They did not want to spend money on protective gear for us. We lost a lot of members. We went home and exposed our families, our children. And now, instead of this hospital, which is one of the richest hospitals in the state of New York, instead of them helping with staffing, they are profiting in the back of the nurses. I'll give you an example. When my sister here said, in California, med-surg is 4 to 1. Here, sometimes you have 8, you have 10, you have 12 patients. And you are providing the same amount of care that they're doing in California, but you're not taking a break. You're not doing anything. The insurance company still reimbursing this hospital at 100%. They're making profit in our back, and it's not fair, okay? It's not fair to the patient, it's not fair to us. When the hospitals are telling us right now, we don't want to hire because of COVID. They're using COVID as an excuse not to hire nurses. They are freezing position telling us it's COVID, but in the meanwhile, you have patients waiting in the emergency room to go up to the floor and there's no beds. So what are you telling us? You don't have enough money, you don't have enough patients, and you're getting reimbursement from the government. And we're coming in to work every day. As the nurse, you dare not make a mistake, because you're gonna be right in there, you're gonna get written up, you're gonna get suspended. Am I not correct, nurses? Okay, the profit, we come to work every day. We give it 100%. As a nurse, we don't charge fee for service. Can you imagine if we did what the hospital did? Every time you get a bed plan for your patient, you click that, profit in their money. Every time, you'll be rich, but we're not here. We are professional. We're here to care for our patients. Our community, okay, our community, I mean COVID-19 hurt our community, and we know the disparity in healthcare, okay? What did they do? They closed the psych unit, okay? And I tell everybody, your brain is an organ like the rest of your body. It's an illness, okay? We're talking about crimes. They take these patients, they put them on the street. They're not properly medicated. Why is Methodist not opening their psych unit? Open up! Open up! I want it open! Do something! Open up! Okay, amen. If you have a heart attack, they're not gonna close the cardiac unit. Why are they closing the psych unit? Where are the patients going? Because you know why? Privately, as a psych patient, the insurance will not reimburse you the same amount of money. It's all about our money. And then yet, this is the richest hospital. Okay, it's part of Presbyterian Hospital. Take a look at their profit. They have not lost a dime, but we've lost our members, and they expect us to come here every day and work and do our best, but they're not doing their best by us. Because, so we need that safe staffing, and thank you for all the legislation members that are here. We need your help. We need you to help that bill come through, because we need that safe staffing. That's what's gonna save our lives, our community, and it's gonna keep livelihood. If not, people will not go to nursing school. I have 2 daughters right now. With what's going on, I'm not gonna encourage them to be a nurse, but I would like them for them to continue what I've been doing. But we need your help, and we need the community's help. And like I'm gonna say it again. Safe staffing, saves lives. Thank you.
Thank you, Nancy. Next up, I'm going to have Carrie Edwards. Carrie Edwards is a candidate for Brooklyn Borough President.
Thank you, guys. I'm here to put some perspective. I used to be a hospital administrator at another hospital, and my 12-year-old son was diagnosed with diabetes. And the same nurse that saved his life in the ER had to retire early because she was overworked and her body broke down. This week, my former hospital is celebrating Safety Week in honor of a nurse who was beaten into an inch of her life because the patient that she was seeing was mad that it took so long for her to get to him. Let's get into COVID. The same nurses that took care of us during COVID, their colleagues had to take care of them, and there wasn't enough staff to save those lives. So when we look at what COVID has done, that's one thing. But like my colleague just said, Presbyterian is one of the richest hospitals. They took over Methodist because they came to an affluent neighborhood where they felt it was only going to be surgeries an easy way to go. But when they started to realize that they started to become a safety net hospital with emergencies and mental health issues and pediatrics, it wasn't cost effective for them anymore. So I stand with NYSNA not only because of the safe staffing ratios, but I joke with them and say it's safe patient ratios, because the same nurses that are staffs have become patients and we're not taking care of them. And a shameless plug, that is why I'm running for Brooklyn Borough President, because it's time that we take care of all of our communities. And I thank you guys for inviting me as always.
Thank you, Mr. Edwards. Next up, I'm going to have Ari Muma. Ari Muma is a registered nurse and the chairperson of the executive committee at Interfaith Medical Center, right here in Brooklyn. Ari Muma.
Thank you. What do we want?
Safe staffing.
What do we want?
Safe staffing.
When do we want it?
Now.
Brothers and sisters, yesterday, United States of America passed 500,000 deaths, our fellow citizens, because of COVID. Attorney General Tish, in her investigation, realized that most of the deaths we have in nursing home, to start with, are due to inadequate staffing. New York State, we have a lot of millionaires here. We have a lot of money. New York State is the second number in the largest death in the United States. That should not happen. This is not a third world country. That should not happen. We should provide them with staffing. I took care of patients during COVID, and I'm going to tell you what happened during that time. Most of them died because of inadequate staffing. Because of inadequate staffing. The Greater New York Hospital Association, with the hospital administrators and nursing home administrators, they put profits over patient care. They lobby in Albany so that we don't have this patient, the safe staffing. When they are sick, you know what they do? They have a private nurse. They have a private doctor. They have everything that within their strength. But what about us? What about the citizens? This is the time we send our legislators to Albany. This is time, more than any other time, this is the time for them to pass this bill for us. Because we're hearing next month we're going to have another wave if we don't take care of it. There's variants, South African variants and European variants. How are we going to reduce this? How are we going to take care of our patients? When we have one nurse taking care of 8, 9, and 10 patients. This has to stop, and we have to mandate them that they make it a bill, and Kobo is going to sign it and make it a law in New York State that we have safe staffing for quality care bill. What do we want?
When do we want it? Now. Can we send a message to them in Albany to pass this bill as soon as possible? What do we want? Safe staffing. When do we want it? Now. Thank you.
Thank you, Ari. Next up, we're gonna have Miss Joan Brawley. She's here representing NAMI, and she'll tell you all about it.
Hi, I just want to thank you again for always asking us, NAMI, National Alliance on Mental Illness, for coming and speaking. You should know I'm a retired NICE member, and I'm on the board of NAMI, Staten Island. You know, this issue of safe staffing has gone on for decades. And we're done. We're done with this. We are going to hold our legislators, our communities, liable for not fighting for what this has been going on for years. Nurses cannot take care of 10 patients. In order to get into a hospital, you have to be very, very sick. Those days of just coming in doesn't happen. And with the facilities in there, if you read their mission statements and their visions, it's always talking about quality care, commitment to the community. Well, I don't see it. It's just words. We're done with the words. We want action. Behavioral health unit that has still not been opened, when there is research and articles done about the need for mental health care, is inexcusable. At NAMI, we always say there is no health care without mental health care. And our children are suffering. This woman from the pediatric psych unit cannot take care of the children that are in need. Those young people that have completed suicide, which is a very sad, desperate thing for somebody that young to do, is inexcusable. How many young people do we not know of that are contemplating this? They are isolated. They do not have the treatment. How do you send people who need mental health care up to Columbia? Columbia is very good for it. I'm not suggesting that. But when you take people out of their community, that which they know, they feel alone and isolated. They need to stop this. This is nationwide. In March, NAMI is going to, we have our legislative agenda. And I guarantee you, we will be asking them, who is taking care of our loved ones? How do you know? What is open to them? Nothing, because they're closing it down. It needs to stop. And we need to take those healthcare workers that are at the bedside and give them the tools that they need. When a physician comes into a hospital, they get what they need. If you are really, truly committed to your community, if you really, truly give quality care, then you will have those healthcare workers at the bedside doing it. Thank you very much. Bless you all.
Thank you, Joan. Next up, we're going to have Miss Joanne Finn. Joanne Finn is a registered nurse here, a frontline worker in the ED, and she's also a member on the executive committee here at New York Presbyterian Brooklyn Methodist.
Good afternoon. I'm here to speak of the loss of nurses in Methodist since December. We've lost over 100 nurses that have retired or left the community. We need the nurses. The acuity is increasing. Acuity is what hospitals use to measure how sick the patient is. And the problem is this: one nurse cannot take care of 10 to 15 patients who are extremely sick. The COVID patients come in extremely sick, and short of breath and difficulty breathing, and you're running from patient to patient. This is not safe for our patients. People say staffing, oh, you just want to lighten your load. No, we want to improve and take proper care of the people that come here, entrusting their lives to us to make sure that they get better and rejoin their loved ones and restart their lives as best as they can. We need the safe staffing bill. We need to be able to take proper care of our community and your loved ones as well as ours. Thank you.
Thank you, Joanne. In closing, we heard so many stories that point to one solution. What is that solution? Safe staffing saves lives. Every patient in New York deserves safe staffing. Hospitals are not going to make the change on their own, so we have to make that change for them. Our elected officials, you need to hear the cry. Safe staffing saves lives. Healthcare workers have been lobbying against safe staffing for years. This is nothing new. We the people, the healthcare workers, patients, community, and elected leaders, we need to hold them accountable to the basic safety standard. A majority of state legislators support the Safe Staffing for Quality Care Act. We need safe staff, equitable standards for all New Yorkers now. Safe staffing, save life. When do we want it? Now. What do we want? Safe staffing. When do we want it? Now. Thank you.
Thank you, everybody.